Recently, Dr. Jose Cabañas began his tenure as Wake County's Director of Emergency Medical Services. Dr. Cabañas returns to Wake County after serving as Deputy Director for the Travis County Emergency Medical System in Austin, Texas. Dr. Cabañas replaces longtime Medical Services Director Brent Myers, who resigned last year to work in the private sector. Dr. Cabañas joins us on WGTV for the first time and talk about his new role. Thanks for being here.
Thank you so much, Eric, for having me. It's a great pleasure to be back in Wake County, what I consider my home and EMS system, and it's a pleasure to be back. Thank you for having me.
So, a lot of citizens in Wake County may not know you. Can you share a little bit about your background?
Absolutely. Again, my name is Jose Cabañas. I am the new EMS Medical Director, and I was born and raised in San Juan, Puerto Rico, where actually I grew up until 2008 when I migrated, when I moved here to North Carolina to pursue an EMS fellowship training. I was a pre-hospital first responder for many years in Puerto Rico. I did my medical school training and residency training in Puerto Rico. From there, I came to North Carolina to fulfill my passion of wanting to be an EMS medical director, so I did my fellowship training here with Wake County EMS in collaboration with UNC Chapel Hill, where I did my master's in public health and some research activities.
What are your responsibilities as Director of Emergency Medical Services and as the medical director?
So there's two main functions to my position. Number one is making sure I'm responsible for the overall operation of the system. Granted, we want to make sure that every decision that we make keeps our patients at the center of everything we do. As a medical director, I'm responsible for the clinical operating guidelines and the specific guidelines we provide our providers, so make sure that they can treat our patients in the field, and making sure that they have the education to achieve those goals when they're taking care of patients. And
I guess the average citizen probably has an understanding, or that, when they talk about a paramedic or emergency responder, that all they do, what they probably see on television, they get the patient in the ambulance and they call into the hospital to get direction. But little do they know there's an actual doctor on staff for Wake County EMS.
The fundamental function of any EMS systems is to provide access to emergency services to the community on a 24/7, 365 basis. So I am in contact with our providers 24/7. They need a consult, they need a guidance, we need to respond to a scene, whatever that is. I am Wake County's emergency medicine doctor 24/7.
And as a nationally recognized department, how do you plan on maintaining and really uplifting the initiatives of the department?
Wake County is a leading EMS system in the nation. And there's several things to this. Obviously, as any new position, the first 6-8 months, we're trying to engage in communication with our workforce, communicating with our community stakeholders, talking to our strategic partners in our community to understand what the needs are, what's the progress on the ongoing projects that we have as a system, and from there make decisions on realignments of priorities with the ultimate goal that we're providing the highest quality care to our community.
With your experience working in the medical field, do you feel the current changes have been beneficial to Wake County's EMS department and also the community, such as the integrated health care?
So our community paramedicine program, also known locally as the Advanced Practice Paramedic Program, is probably the most innovative program of this nature in the country today. Wake County, as a system, have made significant commitments and investments to make sure this program is successful. And I can tell our community that we have made significant clinical impact on specific target populations that require more than just access on a traditional way to go to the emergency department. Granted, there's still a lot of moving parts to how healthcare is going to finalize or end up in this reform, financial reform that's been going on for the past several years, and how can we take advantage of that future financial structure in the healthcare system that we can position ourselves to recoup some costs and actually add capacity to that program.
Dr. Jose Cabanas, Director of Wake County's Emergency Medical Services. Thanks for being here and welcome back to Wake County.
Thank you, sir. It's a great pleasure to be back.
Yes, sir. Keep up with the latest Wake County news by visiting us online at wakeup.com/news or on Facebook or Twitter. That's our show for today. Thanks for watching.